Hi everyone, my name is Lee Nguyen. Today I would like to present my capstone topic about hospital acquired breast ulcer prevention in intensive care unit. So here's this object I will mention in this presentation. I will talk about the rationale and purpose of this proposal, and then I will mention about background and significance of proposal topic and problem statement, literature review, proposal plan description, implementation, evaluation, dissemination, and the last one will be a summary of the presentation. So about the rationale and purpose of this project, like you can see on the screen that every year there are 2.5 million patients in the US acute facility suffer from the breast ulcer or breast injury. And on the right side of the screen, you can see there are many type of patients who will suffer from breast ulcer. So these patients including patient in the nursing home, patient have the core injury, or like this patient like spend a lot of time in bed and not able to mobilize, or sometimes like in ICU, like patient in coma or lost of consciousness. So they have high risk to get the breast ulcer. And because breast ulcer, especially the hospital acquired breast ulcer injury, will cost a lot of money for the healthcare facility. And they estimate that it's around $11 billion every year the hospital spend for the treatment of a breast ulcer or breast injury in America. And I have to say, breast ulcer is a very common complication in intensive care unit, even though it's very preventable and treatable. Because patients in the ICU, like who are sedated, ventilated, and bedridden for a long period. So according to research, they show that around 60,000 patients die from the complication of breast ulcer. And patients who have breast ulcer will suffer from pain, complication of infection, and like also a damage of body image. And that will affect their quality of life and may will contribute to another disease. Also, the development of the breast also reflects the poor nursing patient care. So you can see on the screen, this is the example of the ICU patient who have who intubated and bed rest, not able to turn himself. So with these kind of patient, they immobilize, they in coma, they lost their consciousness. So they're not able to turn to relieve the pressure. From that reason, they will develop a breast ulcer during the stay in the ICU. So like I mentioned earlier, breast ulcer is a very common preventable complication for the patient in the ICU. So the question is, what is solution? If that's a common but preventable problem, what can we do to solve the problem or improve that or even prevent that? About the background and significance of proposed topic, I would like to share with you about the situation that we are facing in the intensive care unit in the St. Charles Medical Center. So the primary nurse and the certified nurse assistant are responsible for turning the patient around the log. Even though the team applied preventive intervention for the breast ulcer, but the fact is the hospital acquired breast ulcer incidents still occur. The reason for that, I can think about that because the staff doesn't have enough time to reposition the patient every 1 or 2 hours as required. In other case, patients are not stable and may need the comprehensive assessment to be repositioned. So even take more time, and they have staff shortage. So that even make it more difficult for the primary nurse to able to turn the patient every 1 to 2 hours. And the question is, do we have another intervention or another solution? We're able to support or assist the primary nurse to turn the patient and make sure the patient be turned in schedule, so they can prevent the breast ulcer incident. So the problem statement for this proposal is, in critical care setting, how does the additional of turning management system compared to primary nurse turning affect the hospital acquired breast ulcer? Okay, here is the literature review for the proposal. And on the screen that you see, I want to compare between the breast, if we just use the primary nurse for turning patient, or we can use the turn team or the automatic turning system on the left side. So according to the study by Cortez in 2021, ICU patients benefit from hourly reposition. However, they are also found a complication from frequently turning the patient, so that hypoxia and hemodynamic changes. So a lot of research that they prove that with the turn team, patient is get more benefit because they being turned more frequently. And they also report that the team member are more engaged in the hospital acquired breast ulcer control and prevention, because actually the staff has to commit to turn the patient 1 per shift instead of 12 per shift. So less work, but more more effective, but less work for the primary nurse, because they receive the support from the turn team. They also report that they have less pain, less back pain, or work-related physical injury, because they don't have to turn a patient by themselves or just use a machine to turn a patient by themselves. They have the whole team to help them. So basically, because the turn team get involved into the turning patient every 1 or 2 hours, the patient, even though if the shift can go busy, crazy, even though the primary nurse don't have time to turn the patient, but because the turn team do that job, so the turning tasks are completed no matter what. And the primary nurse will have more time to focus on another task, while a turn team help to turn a patient based on a schedule. Also, another study proved that with the turn team program, it is the best. They is reinforced the best practice for the hospital acquired breast ulcer control, and also the patient outcome are improved during the hospitalization, and it shortened the length of stay. So with this intervention, actually they require no injury in staff personnel, and making this type of intervention reasonable and effective in improving the frequency of repositioning and decreasing breast ulcer prevalent rate. So on the left side of the screen, you see there is automatic reposition system. Thanks for the development of technology, they're able to apply this into the healthcare, and a lot of hospitals they've been using that system. So this system basically will monitor the patient temperature. They have a sensor to connect to the patient, and they monitor the patient's temperature to see if it's a time for the patient to turn. Some lights they even have the leaf put on the patient. So if they connect to the monitor on the nursing station, just like the tele monitor, so the nurse or a team member will able to see if the patient is need to turn or not, and is it the time to turn the patient or not. And also with this turning system, it can be automatic turn by itself, or the nurse or the nurse or the caretaker can by themselves able to turn a patient, but they don't have to put a lot of work or strain to turn a patient. However, this system may hard to use, complicated because it have a complex structure, and it is costly. So this is the table I compare between the benefit and the advantage of this intervention, the turn team, and the automatic reposition system. So on the left side is the benefit I already mentioned on the reverse slide, and on the right side you see this is the advantage of this intervention. So like a turn team, because they didn't know a patient like a rivalry nurse, so maybe they don't know when the patient need to be turned, like if the patient have stable hemodynamic, or the status is unstable and the patient should not be turned. So that is one of the disadvantage of the turn team, because the hospital use turn team to for every patient, not specific one. So maybe they don't know about the patient as much like the primary nurse. And also they may have to recruit a new member for the turn team. That will cost more money for the human resource. And for the turning system, like I mentioned, it is hard, it's maybe complex and it's hard to use, so they require a specific training for like staff to able to use that system. And in a study by Steele in 2012, that turning the patient every 2 hours by a turn team may improve the breast ulcer incident and the redden score in the surgical ICU. However, in that study, they also found that 100% of patients with hemodynamic instability will require the vessel pressure medication to maintain the mean arterial blood pressure higher than 65. And also with the turn team program in a study by Hope in 2004, they also mentioned that the nosocomial infection can be a concern when you are turn team, because like if the turn team go to infectious patient and they don't do appropriate PPE or precaution, and then they can get affected and then spread that infection to another patient when they go to turn another patient. So like I mentioned in a previous slide, this intervention, including the turn team and the automatic reposition system, are very beneficial for ICU patients and ICU nurses, staff. However, we need to know how to implement the intervention in the right way and also find solution for their communication. So in this slide, I would like mention about the proposal plan description, how I convince, how I apply this proposal project in my hospital. I will consider the stakeholder, including the nursing staff, nurse manager, nurse educator, provider, patient family member, and quality and risk control department will involve into this project. So again, because this is a new concept in practice, they may have the proposal probably faced with the refusal from the staff and might be denied. So to able to get it successful, I will break the process into 3 small phases to able to present the proposal and also educate the staff on intervention, teamwork, communication with the intervention and its communication. So education communication is really important while applying the process into the like in the unit. Also, the role fighter must also work with the turn team to able to place the order within accurate time frame and consider the pro and pros and cons of frequent repositioning individual patient. The nurse manager may have to recruit a new employee for the turn team. That also include into the phases. So how to implement this proposal into real life? So I would like to break this into 3 main phases, and the time for the process is a year. So in the first phase, the staff have to take the online courses about the intervention, learn about automatic turning system concept, and about the definition of turn team, what is function, and how to communicate with the team member. Also, the staff will receive the clinical practice and education in a skill fair where the nurse educator, nurse manager will educate them how to operate an automatic preposition system and they need to take the test in the end to be certified to use the system in a safe way. So at the same time, the current nurses and the caretaker are encouraged to sign up for the turn team assignment, because this will help the solution for the nurse manager when they try to recruit a new nurses. And also this staff already know the patient, so they're able to communicate better and know how to work with each other in a better way. So let's go to phase 2 and phase 3. In phase 2, this intervention, the turn team, and the reposition system will be applied to 50% of the patient in the ICU. And that can be a sample to compare to the patient doesn't have this intervention. And the data will be collected every shift and every 2 weeks, and be analyzed by nurse manager and be analyzed by nurse manager. Also can be evaluated by the wound care nurse to see the result from the intervention. In phase 3, the intervention will be applied to 100% of patient population. And the same thing, the data and the feedback will be collected. Adjustment will be made as needed. So how do they able to evaluate the process? I would say the outcome expected is every team member will excited about the proposal for the first phase. And in the phase 1, the staff performance in online training call will be evaluated on a pathway learning system, and it is mandatory, so the nursing staff have to take that class online. Nurse educator will evaluate staff performance on the automatic turning machine and get a feedback from them. Will individually educate them and practice on the machine before they be certified and able to use the machine. In phase 2 and phase 3, the hospital acquired breast ulcer incident rate will be expected to decrease and recorded via the incident rate report system. So it means like whenever a primary nurse or a caretaker or even a wound care nurse noted that a breast ulcer which developed during the hospitalization, they will have to report by using the incident report system. And because of that, the nurse manager were able to keep track of all the incident related to the hospital acquired breast ulcer, and also can compare that to see if the intervention have the positive effect on the breast ulcer prevention and control. Okay, so we will expect that the incident rate will be decreased after after using the turn team and the automatic reposition system. Okay, talking about the dissemination. So if this proposal project is successful in my unit, I would love to discuss with the nurse manager and the nurse educator. Is any opportunity I can present that to other coworker in a different unit, and if it's get accepted and applied and be successful, I would like to contact to American Nurse Association and develop proposal to a higher level, maybe introduce this project to other facility and in a different hospital setting, because the intervention not just beneficial for ICU patient, I believe is can bring a benefit and is improve the hospital acquired breast ulcer prevention and control in a different setting. During this project, I have a chance to discuss with nurse how who working is an ICU nurse at Mayo Hospital, and as we know that Mayo Hospital is the number one hospital overall and number one in the more specialty in America. And nurse how told me that they have been using a turn team and resort nurses for the breast ulcer control and prevention in the ICU. And she mentioned that it's very beneficial for ICU patient. They're able to see the improvement of the patient outcome and also reduce the cost because they reduce the breast ulcer incident. Also, they just mentioned about there are a need of communication between the primary nurse and a turn team. They have to communicate clear and significantly to able to perform the assignment. So for the conclusion, I would like to say it's really necessary for ICU patient to be turned every 1 to 2 hours, and primary nurse turn only is will not enough and not efficient. So turn team and automatic reposition system will be the best solution for this problem, even though they may have the complication during the turning the patient. But if the turn team able to communicate with the primary nurse and know how to monitor assess the patient, they will able to maximize the benefit of this intervention. And of course, the nursing staff need to be educated on the turn team and also the turning system. Therefore, I did recommend that apply the turning system and the turn team into the hospital acquired breast ulcer prevention and control intervention. In the last two slides, I did take the preferences for my presentation, and really thank you for your time to listen to my presentation. I did think that this proposal will bring a benefit for your unit on the breast ulcer prevention and control. And thank you again for listening.